Well, thank you very much, Mandy, for the introduction. Can everybody see my screen?
Yes.
Sounds good. So today we're going to be talking about sickle cell disease and particularly living a full life with sickle cell disease. As Mandy mentioned, we have Grant, who's also on the line, and we'll sort of be doing this presentation together. And then also Jackie from the Sickle Cell Disease Organization here in Boston, who will also be chiming in from time to time. And then, of course, if anybody on the call has any comments, any questions, anything to add to what we're going to be talking about, please definitely feel free. And then my colleague Emily Moore will be sort of monitoring the chat as she put in there. If you have any questions, you can put it in there or unmute yourself and she will let us know. And we will address that. But sickle cell disease is an inherited blood disorder. So inherited blood disorder in that it is a disease that it's sort of handed down from parents to children. And it is the most common inherited blood disorder that we know of. It affects a lot of individuals, about 100,000 in the United States, and particularly individuals who are of African descent or might self-identify as Black. So about 1 in 365 babies that are born here in the US who are identified as African-American or Black end up having sickle cell disease. It's also something that is seen in individuals of Hispanic descent, and we see that in about 1 in 16,300 babies who are of Hispanic descent that are born here in the US. And then in Massachusetts in particular, recently, some studies have shown about 250 babies in Massachusetts are born every year with sickle cell disease. And just sort of taking a little bit of a bigger view globally, it's a condition that's also very common in other parts of the world, particularly in African countries. And in my country where I was born and from originally, Ghana, Nigeria is the country with the most number of patients with sickle cell disease, followed by India. And then we do have cases, a lot of cases in South and Central America. And then sometimes people don't realize this, but at the Middle East also, there's a decent number of individuals living with sickle cell disease there. And the reason why it's sort of common in these parts of the world, there's this theory that the sickle cell trait in particular served as protection for individuals who, protection against malaria or getting severe malaria. And so in that setting, individuals who had sickle cell trait would get malaria, wouldn't get severe malaria, and so would end up not dying, and then end up sort of outliving individuals who would get severe malaria and die, and then in that setting will sort of end up living, have children, and pass on the sickle cell gene onto their children. That's how it's so common in these parts of the world. And sort of as for sickle cell trait, the sort of reported prevalence based on research shows that about 1 in 13 individuals who identify as Black or African American, particularly in the US, end up having sickle cell trait. So what is sickle cell disease overall? So it is a disease that primarily affects the blood. So our blood is made up of something called red blood cells that carry oxygen and deliver it throughout different organs within our blood, within our body. And a normal regular red blood cell tends to be circular in shape and very flexible, such that it's able to sort of go through different blood vessels, which can get very small in certain parts of the body, but able to sort of, flexible enough to squish around the blood vessels and travel and still deliver the oxygens that our body needs. In sickle cell disease, the red blood cells end up, especially in situations where there isn't as much, oxygen, for example, high altitude settings. The red blood cells end up forming this sickle shape, or if, you can also think of it like a banana shape. And once the cells form this shape, they are not as flexible as a normal red blood cell. And so end up sort of getting stuck in small blood vessels and causing blockages in these blood vessels that decreases the delivery of oxygen to different organ parts, and then also to different joints in the body. And so with this, patients end up having pain when this happens. Of course, there's so many other sort of things that contribute to the pain. It's not just the blockade, but the blockages is sort of the main in terms of pathophysiology or like scientific explanation for why we see pain in sickle cell disease. The other thing is because the cells are shaped this way and are not as flexible, it's very easy for them to get broken down and break up. And so you have a high cell turnover, as in the cells don't live as long as a regular red blood cell. And that leads to patients having anemia or low blood levels. And that also contributes a lot to the symptoms that patients tend to have, which we'll hear a little bit more about from Grant later during this talk. And so the question is, how does one get sickle cell disease? And sort of as mentioned earlier, it is an inherited disease or a genetic disease, as in it's passed on from generation to generation. So for our red blood cells, trying to simplify things as much as possible, there are two genes that are needed to be able to that sort of like determine what type of red blood cell your body makes. And every individual has two genes that determines their what kind of red blood cell their body will make. And every individual gets one of the genes from their one parent and then the other from the other parent. So in this picture that we have here, the top part has one, this is a picture that I found available online, but it essentially showing one male parent, one female parent. And in this case, black represents sort of a normal gene that would code for a gene that would tell your body to make a normal red blood cell. And then the other, the red part stands for a gene that will tell your body to make sort of like sickled red blood cell. And as I said, I'm trying to simplify it as much as possible, a little bit more complicated in terms of the explanation, but I'm trying to simplify so we can all understand. But essentially, in this picture, both the father in this picture and the mother have a copy of a normal gene and then a copy of the sickle gene. And so when they do have a child, there are multiple possibilities. And if the child ends up getting the sickle gene from the father and the sickle gene from the mother, the child ends up having two copies of the gene that tells the red blood cell to make sort of a sickled red blood cell. And the child ends up having sickle cell disease, as we see in this image where the child is in all red. So wanted to, with that, segue into symptoms of sickle cell disease. Sort of as I mentioned earlier, sickle cell disease is, even though it affects the red blood cells, because of how the red blood cells sort of flows through your whole body and produces oxygen to different organs in the body. Sickle cell disease ends up affecting every single organ in an individual's body. And this image sort of shows all the different organs and how they can be affected. So one, I'll just highlight some of them. So for example, in the brain, individuals can end up having strokes. Sometimes some individuals can have vision loss because it also, we have blood vessels that go into the eye. And so when they get occluded, can also contribute towards vision loss. Patients can have pain, enlarged spleen, and sometimes the spleen also over time doesn't work as well because of sickle cell disease that they have. Patients can sometimes develop kidney injury and kidney disease, and sometimes we see patients ending up having to use dialysis because of it. And then sometimes people can have infections in their lower extremities, or let me say infections in their legs. And that can also even sort of erode into the bones. These sort of symptoms that I've reported, symptoms that we tend to see sort of over time. They tend to develop, although the strokes we do sometimes see them early, even in childhood. But by the sort of, and here symptoms start as early as 6 months of age. And then sort of throughout the lifetime, we sort of see some of these chronic complications. I just wanted to show this picture because this is one of the sort of classic symptoms that we see in babies with sickle cell disease. There are some instances, especially in other parts of the world, where individuals unfortunately do not get diagnosed when they are born. And so they sort of present with these symptoms. And so I just thought it would be good to show this picture in case you come across, or someone, or one of us ends up having a child and they have they have these symptoms, something to keep in the back of our minds when we do send them to the doctor. But this is called dactylitis, which is essentially sort of like a vasocclusive, what I talked about the sickle cells block the blood vessels. You end up having swelling and this happens mostly in babies or children. They end up having significant swelling in their hands and also in the feet too. We see that happen sometimes, and it's very, very painful. And sometimes this is the first way that babies present, and makes doctors think, oh, we should think about possible sickle cell disease. And then the other sort of like main symptom that I'm sure a lot of us have heard about is severe pain. And sometimes this is also called a sickle cell crisis. And I will have Grant coming in shortly to talk a little bit more about this. And then sort of as mentioned, there are the chronic symptoms that we see that I touched upon before. It is the most common symptom of sickle cell disease. Starts as early as 6 months of age, and sort of occurs throughout the lifespan of an individual with sickle cell disease. There are sort of two main types of pain when we think about sickle cell disease pain, at least from the medical perspective. We think mostly of acute pain, which can be quick onset. It's usually very severe, very intense, happens in a short span of time. As in it comes on a short span of time, and it can last for a short time, but it can also last for a while. And then as people, especially as people with sickle cell disease grow older, the sort of episodes of quick acute pain eventually also evolve into chronic, sort of like all the time, always there pain. And then most commonly, we tend to see the pain in the joints, in the low back, and in the hips. And this has to do with sort of the blood vessels in these places tend to be very small, and so higher chances of having sort of blockages in these spaces. And so with that, I'm going to have Grant. Grant, would you mind sort of sharing a little bit about your experience living with sickle? Maybe you can start with how you found out you have sickle cell disease, and then touch upon pain, what sort of triggers your pain, and how you sort of manage pain overall.
Hey everybody, my name is Grant. But I found out I had sickle cell kind of when I was born. It was just like you go to the hospital and your parents like, well, you have sickle cell, right? And as a kid, I don't really know what that means, but what I can tell you is I know how the pain felt, right? And I mean, this type of pain, it's hard to explain to people. It's hard to really try to, give them the perspective of what you're living with, right? So I want you to imagine, right, like your worst type of cramp that you've ever had, right? Whether it was like a hamstring or from like a period or like sports or whatever, right? Just like imagine that, but like inside of your bone, right? Like, so it's like it can't get targeted via like a massage, like you can massage out like a cramp or something. So it's like, it's very intense, and it hurts, it hurts a lot. For me, my sickle cell pain usually occurs throughout my extremities, like Miriam was saying, right? And my arms and my legs. Those are the two most frequent places that it happens. It took a lot of prayer. It took a lot of nights. I'm in the hospital for weeks at a time, right? I know Miriam mentioned, acute pain versus, quick onset pain, and there were times where I was in the hospital for 4 weeks, right? So it's not something that's just, oh, okay, it's just a little bit of pain and then it'll go away, right? I mean, it takes a lot of like heavy medication, a lot of heat, especially if it was caused by the cold. It takes a lot of that. I probably have maybe like 75 heat packs that you squeeze just under my sink, right? Just in case I'm having some pain, right? Or you constantly have to drink a lot of water so that you can really go ahead and resupply your body with, with the oxygen that it needs, right? So that you don't get thirsty, or dehydrated, because dehydration will cause you to have, sickle cell pain and all that. And if I have children who have sickle cell, best believe I will be pushing them, right? But with understanding of, okay, well, I knew what worked for me, and I didn't really have anybody. I knew 0 people who had sickle cell disease, and so it was something where, I'm kind of figuring it out on my own, right? And I had to test the waters, and I had to have theories and test theories and prove it. And of course, my parents are here right now, and they'll tell you like, no, as a parent would, right? Try to be safe. Don't try to go ahead and push your body and do stupid things. But of course, I don't listen, because I'm just like, listen, I'm the one living with it, right? Like any parent will want the best for you, but when you live with it, it's really up to you. And so you're really just pushing your body and anything that you do.
Managing sickle cell disease pain sort of varies from patient to patient. I know Grant already mentioned some of the things that he uses and does to manage his sickle cell disease pain. Sounds like heating pads were a big thing for Grant that he had touched upon. But in general, when we think about managing someone's sickle cell disease pain, first of all, we try to think about what triggered the pain. For some patients, it can just happen without any clear trigger. Not some patients, a lot of times actually it happens without any clear trigger. So you sort of just manage the pain itself. But in some cases, there's a clear trigger. Sometimes infections can cause that. And that's why it's important if, someone's having an acute pain episode and it's not getting better. So it's important to seek medical attention in case there's something else that's sort of, triggering the pain, in addition to just a regular sort of pain episode. Unfortunately, there is a lot of stigma around pain management, particularly for sickle cell disease. And, it stems from, the use of opioids for the management of pain. That is the treatment that we have available, and that is the treatment for pain for sickle cell disease. But unfortunately, because of association with other sort of like public health crisis, it's unfortunately also created stigma for individuals who have sickle cell disease. And then also there's also, as we sort of shared earlier, predominantly affects individuals of African or who self-identify as Black or African American. And so there's also a lot of racism that is associated with like how the healthcare system approaches individuals with sickle cell disease because of that.
I think a lot of people, when they hear the word pain, they're not, nobody can fathom how deep sickle cell pain really runs. So, even growing up and, explaining to like my elementary or middle school teachers that I'm having pain, for them, they don't understand how intense the pain can be, because typically, like you were saying, Miriam, it's such a different treatment for sickle cell pain, and then some of them would say, okay, we'll just use an ice pack. And I'm like, you don't understand. It's because I'm cold. Like, it's because it's cold outside is why I'm having the pain. If you put an ice pack on me, I'm going to go into a crisis and I'm going to have to get like rushed to the hospital. You know what I mean? Or even now, if I go down to the emergency room, if you specifically do not have like your hematologist or like your like a POC, which states like these are the medications that you need, right? A lot of emergency rooms will be hesitant because, like you were saying, opioids, a lot of people get so addicted to opioids. So it's a very tough and challenging situation trying to balance it out, because typically, when you have intense pain, something like oxycodone or fentanyl is the only things that are strong enough to really subdue the pain. But those are so addictive, and can have a very almost negative impact, depending on how often you're using them. So it's tough to really, balance it, because a lot of, doctors would be hesitant to give you that prescription, right? Because it's like, oh, I don't want you to get addicted. But it's also like, well, even that commute from home to the hospital in itself is tough.
One main medication that had been FDA approved for the management of sickle cell disease, which is hydroxyurea, and it was approved in 1998. That this medication has been shown time and time again to decrease the number of acute pain episodes. And there's more research also coming out that's showing that it sort of decreases stroke in patients with sickle cell disease. The chronic complications also, we see less of like the kidney dysfunction, the heart dysfunction in individuals who take hydroxyurea compared to individuals who do not take hydroxyurea. Of course, even though it's been around for a while, it is a medication that, especially when it started, you still need to follow up a little bit more regularly with your provider, so that we can make sure that, of course, every medication has some side effects, but if with routine labs and monitoring, you're able to make sure you're on an individual's on a dose that does, helps with management of sickle cell disease, but also doesn't cause too much side effects. And generally, it's pretty safe, and a lot of patients are on it and feel okay, and do not have too many issues in terms of side effects with it. Of course, taking medication every day presents with its own challenges. In 2017, L-glutamine, another name for it is Indari, was approved, and this is a powder medication, sort of dissolved in water, and people take it, and that's also been shown to decrease acute episodes. 2019, so very recent, medication called prizanlizumab, or Adakveo is the sort of like easier name, although still a little bit complicated to say, that has come out. The only thing with this, though, is it's sort of a monthly infusion, so you do have to go to the clinic and get the medication infused. And it also, clinical trials showed that it reduced the number of acute episodes. And then the other medication that also was approved in 2019 is voxelotor or oxybrita. And the main indication, the main reason why your a hematologist may put someone on this medication is to increase their hemoglobin level. It's been shown in studies to increase the hemoglobin level, and we've sort of seen that low hemoglobin anemia has its own issues, down the line. These last three medications, because they are fairly new, and a lot of the chronic complications with sickle cell disease sort of take time to manifest, it's not clear whether they do decrease the chances of developing those chronic complications. But with them being able to decrease acute episodes, the scientific community is hopeful that would also see some effect on the chronic complications of sickle cell disease. Is sickle cell disease curable? And the simple and short answer is yes, it is curable. And currently, there's sort of like two main ways to cure sickle cell disease. One of them, which has been in existence for some time, is bone marrow transplant. And so essentially what happens is, the red blood cells you have cells in your bone marrow that sort of multiply over and over again to make the red blood cells. So the idea behind the bone marrow transplant is for an individual with sickle cell disease, you're given medications that essentially wipe away your bone marrow, and then you're given someone else's bone marrow. So the cells from someone else's bone marrow is given to you. And the way the cells are, they find their way into your bone marrow, and then they multiply. And because the person who gives you their bone marrow would not have sickle cell disease, the red blood cells that you will be producing would not be sickle red blood cells. And this has, been shown to cure individuals with sickle cell disease. It's generally better when done when individuals are younger, because so the chronic complications sort of start building up more and more in the young adult time. And so if someone who's a little bit older in age gets the bone marrow transplant, they will be definitely they'll be cured of sickle cell disease. The acute pain episodes vanishes, but the chronic complications that they've sort of developed over time don't necessarily revert. They still stay there. So ideally recommended to be done when people are younger, but being done even people who are a little bit older or later in their young adult time. The thing is, though, is that an individual does need a donor. And then in terms of the donor, usually ideally, someone in the family, like a sibling whose sort of genetic makeup is a little bit similar to the patient's genetic makeup, just to reduce the incidence of complications from that. And as you can imagine, that can be difficult to find a family member, a sibling who would be able to donate their bone marrow for a bone marrow transplant. And then there is sort of like a bone marrow transplant registry that random people sign up to donate bone marrow. And so can also see whether there's someone in that registry that matches with an individual with sickle cell disease who is interested in bone marrow transplant. The other thing that is currently sort of still in the clinical trials stage is gene therapy or gene editing. So in this case, actually, instead of having someone else's red blood cells from their bone marrow given to an individual with sickle cell disease, actually take the individual with sickle cell disease own cells and try to edit the gene and edit at the gene level such that it doesn't make, so when it gets back, it's put back into the bone marrow, it doesn't tell your body to make sickled red blood cell, but it tells your body to make regular red blood cells, or like a slightly different type of red blood cell that doesn't sickle, like sickle cell. As mentioned, this is sort of still at a clinical trials phase, although the results so far have been promising. Similar to the bone marrow transplant, there are sort of like risks associated with the procedure. Cost is also a very big barrier. And then again, availability is very limited. Globally. This slide just talks about, in the past, I thought sickle cell was a disease of childhood, like, if someone has sickle cell disease, it was like a death sentence. But this is just showing that with time, the life expectancy for individuals with sickle cell disease, which Grant is a testimony for that too, has been increasing, especially with things like penicillin prophylaxis, newborn screening, so identifying patients who do have sickle cell disease and plugging them into care has been critical. And then hydroxyurea coming into the scene, and then like sort of paying attention to stroke. So in the US and the UK, actually 95% and up of patients survive beyond childhood, like into their young adult years. And then in Jamaica, 84%. Unfortunately, African countries are still lagging a little bit behind, but we're starting, there aren't numbers yet, but we're starting to see, patients sort of living sort of beyond childhood and living into their young adult years. And then in terms of the question about, prevention of sickle cell disease for individuals who have the sickle cell trait. So generally the way for someone to get sickle cell disease is to have the gene for two parents. And so generally, and this is a little bit of a controversial sort of suggestion or like topic, but generally it's recommended that individuals who are of childbearing age or interested in having a child, and particularly of African American or self-identify as Black, Hispanic, or from parts of the world where sickle cell disease is common, it's recommended that such individuals do check their sickle cell genotype.
Even growing up, my parents were like, listen, be aware, just like make sure, whoever you're married, like that's one of the things that you want to make sure that you ask, you know what I mean? So I would definitely be, letting my kids know that, just be mindful. Luckily for me, my wife doesn't carry the trait, which is fantastic. And luckily by God, I was blessed with having a wonderful wife who didn't, and they matched up. Otherwise, I would have been heartbroken if she did, especially when I fell in love. So, I mean, it's definitely tough to go ahead, and it's like you don't want that to be the defining factor, but you have to take a look at it and say, okay, well, everything that I've gone through, do I care more about my, love for my partner, right, my potential wife, or would I want my kid to go through that same thing? So it's like you have to kind of like balance that and then scale in itself and really figure out what's more important to you.
Hi, everyone. Good evening. Thank you for having me here tonight. Miriam, that was very engaging. I thoroughly enjoyed your presentation, and Grant, nice to meet you virtually. Hopefully one day we can get you out to come out and talk for an organization as well, with our organization, or meet with us. So I'm Jackie Haley. I'm the ED for the Greater Boston Sickle Cell Disease Association. Our organization was founded 25 years ago by a pastor out of a need for services in the community for those living with sickle cell disease. And so 25 years later, we're still carrying out that mission around advocacy, education awareness, and providing programs and services for those living with sickle cell disease. We were able to work with or partner with the Center for Law and Education. Back in 2015, we filed a civil suit against Boston Public Schools. And now we won and worked with Boston Public School to create policies for accommodations for children living with sickle cell disease, as well as creating training for educators and nurses in Boston Public Schools. Our focus this year is on legislative advocacy. And so we're working with advocating and with partners to really get sickle cell disease as a line item in the budget in the State House. This has never been done before. And so we're hoping that this is the year that we can be successful in doing this. It just got into the House budget, and now we're fighting to get it in the final budget. So call your senators and tell them we need to get sickle cell disease, because the funding that comes out of that will be used to help with programs and services for those living with sickle cell disease.
I want to thank all three of you, Dr. Osei, Gran Norvin, and also Jackie Hadley, for this was really a great conversation, very informative. Thank you all very much. And thank you to the audience for having such wonderful questions too. It just was really great. And finally, I also want to thank Emily Moore. She has been on the committee for these talks for the past year and has been like a real foundation and pillar. She's always available to help and is a great facilitator. So thank you also, Dr. Moore. Our next talk is in July, and we will send out information. It'll probably be on lung disease, but it's summer and we're just getting ourselves organized now. So thank you all and have a good rest of the evening.